Chairman, Deputies, Senators, thank you for hosting us today. We are representatives of a group of parents who have come together from all over the country to form REGRET, which stands for Reactions and Effects of Gardasil Resulting in Extreme Trauma. We are a support group for families with children suffering long-term and life-changing health issues following the Gardasil HPV vaccination. Our 130 daughters display a series of debilitating, long-term and chronic symptoms corresponding directly with the Gardasil Patient Information Leaflet, PIL, by their manufacturer. The PIL is the folded leaflet everyone gets included in their medication package when they go into the pharmacy to collect medication. We're not given this information when signing the consent form for our daughters to get vaccinated with the Gardasil HPV vaccine in first-year secondary school. Instead, we're giving a marketing leaflet outlining 5 mild side effects. Nowhere does it tell us about the risk of long-term, chronic, life-changing side effects. It doesn't tell us about the daily severe headaches our girls struggle with for years, the nausea and stomach pains, the debilitating fatigue, the fainting and seizures, and the onset of autoimmune disorders. It doesn't tell us that we might regularly end up in the A&E department watching our teenagers scream in pain, whilst doctors rule out one condition after the other. It doesn't tell us that our previously healthy, sporty and high-achieving girls might never play sports again, never mind socialising with friends, enjoying what should be the most carefree time in their lives. It doesn't tell us about the impact of these illnesses on our daughters' ability to continue their education and the resulting psychological impact of having this basic human right taken away. Parents are not prepared for the emotional strain of watching their child struggle to get out of bed to face yet another day of fatigue, muscle weakness, dizziness and inability to concentrate. We also worry about how we will manage to raise the funds to meet our daughters' many medical needs in years to come. Some of our daughters have contracted potentially life-threatening conditions, rare or unheard of in children their age. And yes, some doctors do admit that they think it's connected with the Gardasil HPV vaccination. But most medical professionals in GP clinics, A&E departments and hospitals around Ireland will not acknowledge any connection with this vaccine. And maybe if we as parents had been given the PIL, we could have pointed out the list of possible side effects to these doctors. But instead we struggled, sometimes for years, to understand our previously healthy daughters' range of health issues before making the connection. We believe there is a significant underreporting of HPV vaccine adverse reactions to the HPRA. Before contacting REGRET, most parents had never heard of the HPRA or the Adverse Event Reporting System. It's also their experience that doctors and consultants failed to report suspicions of side effects, even when parents pointed out the connection. We all wanted the very best for our children. We trusted the HSA would act responsibly and respect our right as parents to be fully and honestly informed before making the decision to sign the consent form. This is a significant decision for parents, considering Ireland is one of the very few countries in the developed world that still do not have a vaccine damage compensation scheme. 3 years ago, when Gardasil vaccination programme was discussed by this very committee, Dr. Colette Bonner from the Department of Health noted the committee's concern that there is no vaccine damage compensation scheme. She said, "There is an expert report which we are considering. I will convey the committee's concerns both to the Secretary-General and the Minister on this point." We know now that Gardasil got CDC fast-track approval and underwent a mere 6 months of human trial research. Subjects were only followed for 5 to 15 days in the safety studies, and only 1,200 girls under 16 years of age participated, even though this is the very target age for the vaccine. During these clinical safety trials, paid for by Merck, 95% of the placebo injections contained the same toxic aluminium adjuvant as the vaccine itself, which of course resulted in Merck being able to claim that adverse reactions were not significantly higher than those in the placebo group. What we also know is that in a later 4-year clinical trial by Merck, 1 in 40 of trial participants reported a serious adverse event after taking the Gardasil HPV vaccine. And in addition to this, 1 in 30 also reported a new autoimmune condition. Given the current rate of incidence of cervical cancer in Ireland is only 13 in 100,000, the benefits of this vaccine hardly appear to outweigh the risks. The benefits, according to politicians and health authorities, is that 50 to 60 lives a year will be saved by the HPV vaccine in Ireland. However, health technology assessment reports from other countries show that these statistics can only result from the combined effect of screening plus vaccination. In Ireland, these figures are being presented as the effect of the vaccination alone. And the truth is that our girls will still require ongoing and regular pap smear tests, as protection from the HPV vaccine has not been shown to last any longer than 8 years. There are worldwide concerns mounting for the safety of the Gardasil HPV vaccine. It has now been dropped from the childhood immunisation schedule in Denmark and replaced with an alternative vaccine. And as of September the 1st, approximately 1,100 girls were being treated in 5 Danish regional medical centres for suspected Gardasil-related conditions. Japan no longer recommends the HPV vaccine after conducting its own investigation into serious reactions. And this month we've been told that the Gardasil safety has been reaffirmed based on the results of an EMA review, which found no link between Gardasil and 2 specific medical conditions, CRPS and POTS. But research director and consultant Dr. Jesper Melsen from Denmark has studied many girls with suspected adverse reactions to the HPV vaccine. He has criticised the EMA for not releasing the evidence of records and data when submitting their early release conclusion. Dr. Melsen is now heading an independent investigation into the HPV vaccine, with the results due out in April 2016. And speaking in June this year, he said a realistic estimate is that 1 in 500 girls experience serious side effects. Spanish doctor and professor of public health, Carlos Alvarez Dartes, from the University of Alicante, has initiated a petition against the HPV vaccine. He's a former president of the European Public Health Association and was also an advisor to the World Health Organization. He's now calling for an immediate stop to the vaccine. Last month, researchers in Canada studied 170 teenagers for 4 years, and they now question both the safety and benefits of the vaccine, urging Quebec to halt HPV immunisation until its alleged dangers have been independently investigated. And in France, we have the MEP, Michel Ravasi, has compiled a large petition with hundreds of physician signatures calling for a moratorium of the HPV vaccine. As parents, we feel that the Minister of Health has a duty of care for 130 teenage girls suffering chronic ill health since the Gardasil HPV vaccination. However, he has consistently declined all our requests for a meeting to discuss our daughter's situation. In a private Member Stall question to the Minister of Health in October, Deputy Maureen O'Sullivan asked for the reason that parents are not provided a copy of the patient information leaflet prior to signing the consent form for the HPV vaccine. The HSE provided a response in the form of a letter from Dr. Kevin Kelleher, Assistant National Director of Public Health, which included this explanation. All the information provided to parents about vaccination is prepared from the available licence documentation for each vaccine, the summary of product characteristics and the patient information leaflet. The information is presented in clear, simple language and approved by the National Adult Literacy Agency, NALA, so that it can be understood by all adults, as the average reading age in Ireland is 12 years of age. So the official reason for the HSE withholding the list of known serious, debilitating and long-term side effects from the HPV vaccine information literature is because the average adult reading age is 12 years old. And on that basis, the content of these information leaflets is determined. I hope the absurdity of this logic is not lost on the committee. And as an aside, I want to note that it was Merck, Sharp and Dohme who sponsored NALA's 2007 Irish Health Literacy Research Project. And this is the manufacturer of the Gardasil vaccine. There are some who would rather dismiss us as anti-vaccine parents, but we all gave our other children their vaccinations, just as we all signed a consent form for this one. We thought we were doing the very best for them, but instead we signed away our girls' future, and 5 years later they're still struggling. Our lives will never be the same following the Gardasil HPV vaccination of our daughters, with years taken from them, their parents, their siblings, their grandparents. We've been given no answers, no guidance, no hope. We live with the guilt, sorry, emotional. We live with the guilt of our decision to sign the Gardasil consent form every day, watching our previously healthy young girls struggle to get through their day, with our bags packed 24/7 in case of yet another emergency visit to the hospital. Thank you.
And is it Kiva?